About the recordings, uh, for some reason, 2 recordings on 610. 610 would have been last Thursday, I believe. Yeah, were made. Well, two groups send them to me. Zoom sends me the recordings, and Cloud sends me the recordings. Uh, I may have accidentally posted the same thing twice. Uh, uh, in order to know which one you got, first off, just get it off of the Canvas page, off of our modules, and you'll be fine after I've posted it. A couple of people are telling me, one person anyway, that they can't access the material, the recording from their Canvas page. And for that person that did that, I sent to them my YouTube page with all of my recordings. If you would like that and think it would be helpful to you, there's an explanation of how you can tell which recording was done on which day. Okay? But if you're not having trouble seeing the recordings, if you're even looking at the recordings, some of you are, then let's leave well enough alone. Okay. But if you can't get the recording and you need it because you missed the class for some reason, I can get you the link. Okay. Okay. Got a last question, or are we going to go? We only have to do this sign-in thing once for me. Okay. Well, we've done all of this material, includes lecture and lab. The only part that will be on the test on Thursday will be that material that says lab right after. So those are the things that you really want to hone in on this time. Immediately after the lab is over on Thursday, you got to jump on the lecture material. Okay. I know the lecture material probably seems at this point uh, fairly tame, but that's not the way it comes out when the grade comes out. People don't take it as seriously because so much of it seems to be review, not the ossification, not the joints. No, that should be fairly new. But there's a lot of review material for you that we've just gone over, as you know. Please take it to heart to learn that and to remember that. But right now we're honing in on the lab. And
Charlie,
yeah,
the quiz we took yesterday, was that like lecture questions or lab questions?
questions yesterday.
The quiz.
Oh, the quiz?
Mm-hmm.
Those are lecture. Those are lecture.
Okay.
Okay.
Thank you.
They match up with the lecture topics. I haven't really shown you anything for lab yet. I am going to. Here's our second week right here. And today is the 15th. So I'm supposed to talk about cell division. I'm not. I'm not going to lecture today. I'm going to just do a lot of bone reviewing. I'll lecture tomorrow because you need something to add to your studying when we get past practicum 1. Okay. And first, let me show you a practicum. Maybe I showed you a little of it yesterday. This one is not mine. It would never be mine. because it asks you to type in the answer. But the images are often the same as I use and other instructors use. Okay, so looking at these does not mean they're going to be on the test. Doesn't mean that they won't be on the test either. Okay, but just don't want you to make any assumptions. Okay, this test has 50 points. That means it has 50 questions. Yours will have 100. Okay. And this test was given 50 minutes. When I go up to 100, you won't get 100, you'll get 80 minutes. That's enough. That's enough. This instructor was using Proctorio. And we both, you and I think, have agreed that Proctorio is not user friendly anyway. And now I can take a look at it. I can see it with its answers. This is a nice question. Okay. You recognize the bone is a what? The whole bone?
Scapula.
Yeah, it's a scapula. But the question is to identify the surface. Always read the question. And of course, it's outlined here, stippled, and it wants this surface. Now, you were looking at the anterior or posterior aspect of this bone. Are you looking at anatomical position or the reverse?
Anterior.
Anterior, and that's anatomical. Okay, so this fits up against the back of your rib cage. What is this surface? Well, now you get 5 questions, 5 possible answers, and that should help you out. Is this the subscapular fossa? Could be. I'm not ruling that one out. Is this the posterior surface? No, we already said it can't be that. Is this the blade? Hey, was blade on your study guide? Was blade on your list?
No.
No.
No, so it cannot be that. Okay, shoulder blade. Yeah, that's a great common person's term. I use it, but we don't use it in anatomy. Is it the supra or infrascapular fossa? No, that's on the other side, on either side of the spine. So it only leaves me with one choice, and I would click it, the subscapular fossa. Okay. The fact that it's at the top means nothing because your individual test will be shuffled. Okay. The 5 answers are shuffled for everybody. Okay. So everybody gets a different one. I don't know what that accomplishes, but that's what happens. Here's the second. It's also a scapula, but this is the posterior side. This would be the supraspinous fossa. I'll answer this one. And this would be the infraspinous fossa. But it's asking, watch the arrow, identify this surface. So we want supraspinous fossa. It also happens to be the first one again. Okay. I don't know if that's because this is the instructor's test or what. Sometimes the instructor, I know I'm guilty of it too, will put down the correct answer first so they don't forget to put the correct answer in. Okay. It's easy enough to do. And then I go ahead and figure out 4 other answers, and I rely upon Canvas to shuffle them. The third question here is from a profile from the lateral side. This is the coracoid process, sort of viewing at the same time here. This is the end of the acromion or acromion process. The spine barely shows in here. And this is the glenoid fossa, also known as the glenoid cavity. Yeah, it looks like this is the instructor's actual copy, and they put everything first. Okay, that's fine. The next one, I'll let you answer it. We want to identify this edge. It's only pointing here. Okay, but
Lateral
it's
border.
okay. Uh, here's where the humerus attaches at the glenoid cavity. Here's the vertebral border, and this is the lateral border, also known as the axillary border. Okay, you did that without having any choices because I changed the upper ones myself, but the instructor here is uh, fooling around with having you write things in. So this would be, if I put in lateral border, that should be the right answer. Vertebral border would be wrong. Okay. Medial border would be wrong. Inferior angle would be wrong. Okay. Lateral border could also be, though, the axillary border. And I'm curious as to whether or not that's going to be marked right or wrong. Okay. So I'm going to put axillary border in there. Lateral border is fine. You're having multiple choice, and only one of the two would appear. I'm not putting both of them in there because they both can't be correct. And now this one, I think we can all agree. What's this?
Fine.
Fine.
Spine. But she wants it to us to identify this and type it in as blank of blank. Well, spine of scapula. Now I'm confused. Do I put spine and scapula, or do I write spine of scapula? Because she's already put that in. I hate tests that make me doubt what I'm doing. I think I better put spine of scapula. And in a moment, when I ask it to grade it, I'm going to see if that's not correct. That is a correct answer. That definitely is a correct answer. But I don't know what Canvas is going to make of that. Okay. So we're having a multiple choice test. Don't worry. And the fact that you could identify it is all that's necessary. Okay. I already told you what this one was. What is that guy?
Coracoid process.
Coracoid process. Now, careful. Do you know how to spell coracoid? You weren't doing that. Okay, I think I got it right. If you misspell, it's marked wrong. Completely wrong for a simple juxtaposition of two letters, for instance. Now, that's not fair. That's not fair. Okay, so you answered it, at least one of you did. Okay, I'm sure the rest of you could too. Coracoid process. And then this bone, somebody different.
Clavicle.
Clavicle.
Yeah, I don't mind you. See, I put an E at the end, get marked wrong. Okay, that's the clavicle. And that's it. Do you notice that's an x-ray? Does it give you any trouble? No. The x-rays aren't going to give you any trouble. I hope. Okay. And then here we go with the bone. And all we have to do is identify the bone. I'll do that one. Humerus. Some people put OUS. Okay. Humorous, meaning funny. That'll get marked wrong for people in this person's class. Now, At the end of the humerus, at the distal end, we have a ball-like structure and a spool-like structure, like a spool of thread. What's the ball-like structure? Here and here.
What is it? Capitulum?
Oh, now that's interesting. The way you said it tells me you're going to misspell it. Okay, but it's capitulum.
Oh, shoot. Yeah.
Well, you can't say, oh, shoot, after the test is turned in. You don't have to worry about that with our test. Our test is fair. Our test is what it needs to be, and it's multiple choice. The correct answer will be there. If the correct answer is misspelled, you'll still mark it, and you'll still get credit for it. But I don't intend to misspell anything.
Professor, sorry, Charlie?
Yeah.
Where would the trochlea be on there? That's what I thought it was.
This is the trochlea here. This
Just a
part.
little indentation.
I call it a spool. Okay. You know, like a spool of thread, except one end here is bigger than the other. Okay, then it's sort of got a waist or a thin part here that you can wrap a cord or something around.
So the trochlea is part of the capitulum.
No, they're not. This is one bone. This is the humerus. Everything is part and parcel. It's just like a human body. Name the liver, name the brain. Are they part of the human body? Yeah. So yeah, to answer your question, they are a part of each other, but each part has its own name. Okay. This is a nice medial epicondyle right here. The lateral epicondyle is smaller. Okay. This one, identify the structure. Both arrows point to the same structure. Well, then I want the bigger arrow. Why give me a picture that's small? Okay, see this crease in here? That's what's being referred to. And that has a longer name. Anybody?
Intertubicular sulcus.
That's it. Intertubicular sulcus. Now, it can also be called a groove. And unless the instructor has marked as possible answers everything that is correct, this could get marked wrong because you didn't put groove in. Okay. I'm not trying to worry you. I'm trying to calm you down. You are not going to have to make that choice. Okay, here's the way the radius fits against the larger ulna. And what we want to identify is not all this, but just this point down here. You know it's on
Styloid
what
process?
the what? Styloid process.
Yeah.
Styloid process of what?
Ulna.
Radial styloid process.
Of radius?
Yeah, that's what it is.
Radiostyloid process. I bet you get marked wrong for that. They want it in this form. It's the styloid process. And I'm going to put the of in there. I'm not sure I'm supposed to. Nope, it's not ulna. We just said it's radius. Okay. During the examination, I sit here and I'm quiet. There's no confer Zoom on Thursday. At 1 o'clock, you enter immediately into the test. I don't mind you not starting quite on time. Somebody will be, something happened at the last minute. You can wander into the test as late as, if you don't mind, 1:30. As it approaches 1:30 and 2 or 3 people still haven't started the exam, I send them an email and tell them, please start the exam now. Okay, because after 1:30, if you start late, it all subtracts from your time. It all subtracts from your time, so you don't want that. Okay. But I sit here waiting for problems. The first time I gave a test on Canvas, there was a major problem. The pictures didn't come up. I got a test with 100 pictures and 50 of them didn't come up. And the students are emailing me. I can't see the pictures. I can't see the pictures. Am I supposed to guess or what? So I can go back from the instructor's view and see, oh my God, one of the radial boxes, one of the little O's that has to be filled in. For some reason, I didn't check it, or I unchecked it, or who knows what, but it wasn't checked. And those pictures weren't active. So all I had to do was check it. And the problem was solved in 2 minutes. That's great. But if I hadn't been sitting there, the problem couldn't be solved. So when I give a test and when people ask me for a test outside of regular class time because they have to go someplace or something, it obligates me to make a new test and to sit for hours more on probably on Friday, which is my day off. I consider it my day off. Friday for me. I sleep on Friday. I'll tell you the truth. Okay, so it's important to realize that somebody's here to back up the test if you're having a problem. I had one person write me, and I checked the email during the test, and they said only the first 10 pictures showed up and nothing else. This was not happening to anybody else on the test. Everybody else was fine. So I have to think up a quick solution. And my solution was submit the test now. I'll increase the number of tests you may take, start a second test right away. And as it turned out, the second test loaded perfectly. Okay. So I don't know, something seems to go wrong, just minor with every test, but it's major if you're not there to correct it. Okay. What's this guy? What's the structure? You can look at your notes.
Trochlear notch.
Trochlear notch is one term for it. The old term was semi-lunar notch. I'm going to put in semi-lunar notch. It's correct, but I want to see if it's going to get marked wrong, just for my own curiosity. This is a good view, however, right here, of the radial notch. The head of the radius fits in. And here, the coronoid process.
Yeah, most of the bones that I see on the internet, they're very like white and pale, and they don't have any shading, so you can't really see the creases on them.
Well, some of ours are white and pale too, but I think they're fair. You haven't seen those yet. Okay. Oh, look, the next thing they do is radial notch. You wonder how far I'm going to take you through this? All 50 questions. If at any time you feel that you don't need review, and you don't want to talk over anything, you can bow out today. I usually look for about a 2-hour participation on Zoom, Confer Zoom, but don't shortchange yourself. Okay. This structure at the top of the ulna. What's that?
Oh.
Oh,
Olecranon.
Oh, yes.
olecranon works. Oh yeah, doesn't work.
Olecranon process?
Yes, olecranon process should work too, because that's another name for it. Now, the radius, head, neck, and on the radius, it's the tuberosity. The styloid process. On the ulna, we jump over to the styloid process, and the ulna come up to the coronoid process, the trochlear notch, and the olecranon. So I've told you what this is. This is the radial tuberosity.
Charlie, I have a question.
Yes. Go ahead.
Is it just the radial tuberosity, or is it the greater radial? For some reason I thought it was greater, but I don't know if that's probably not correct, huh?
Head, neck, tuberosity. That's correct. You can just call it tuberosity.
Okay, thanks.
Okay. Head, neck, tuberosity. I don't know the greater tuberosity. I know the greater tubercle and the greater
Okay,
trochlear.
I think
That's in the
confused.
humerus. And the greater trochlear.
Got it. Okay. Thank you for
Okay.
clarifying.
Bear with me. Well, no problem. Okay. Now we're down at the pelvic region. Although this is the coxal bone, we don't call it that. We break it into the three parts: the upper, the ilium, the part you sit on and posterior, then the ischium, and the pubic bone. This cavity receives the head of the somebody's going off and on with their mute, and we need to keep it off unless you're asking a question, but it helps. Okay. Okay, what's the name of this cavity that the head of the femur fits into?
Is that the acetabulum?
Okay. It's interesting how you guys are pronouncing it.
Acetabulum?
Yeah, that's it, acetabulum. Yeah, don't be afraid to unmute to answer a question or ask a question, please. I don't mean that. I just,
Charlie?
yes.
So our practicum, it's going to be similar to where it's like we're going to stay within a certain body section throughout the, like as we go through the questions. Like we're not going to just suddenly go from like the pelvic region all the way up back to the skull and then switch over around.
Generally speaking, it's pretty easy to follow. Usually the skull is first. Okay, but no, you should be able to identify these not in order. You should be able to identify this material. This is question one. Number two is a different part of the body. You should be able to do it. But there's no attempt ever made to purposely mix everything up. So I don't know how to answer to that question. The best way is, if you want to prove you know it and answer it. Okay. May not be what you wanted to hear. Okay, this little guy here is underneath the greater sciatic notch, and before the lesser sciatic notch. What's this little guy?
Ischial spine.
Okay. Of course, we just did this yesterday, and when I actually use the bone box, I intend to start with yesterday's material because it reinforces it quickly. The last material I'll do is the skull. Why? Why wait on tomorrow to do the skull? Because that'll make it the most recent, and I think that's important. Okay, ischial spine.
Charlie, I don't know if this is the correct time to ask, but yesterday I'd asked a question and you wanted me to ask again today. And that was the difference, or what is the true pelvis and the false pelvis?
Okay, we can do it with this one. This is the perfect time. First off, the arrow is pointing to the iliac fossa. Okay, the curved, indented, concave part of the iliac bone. Now, here's the pelvic brim going all the way around. Your study guide has true and false pelvis. If you took your fist, okay, not to a real person, but to this skeleton, and forced your fist down into the pelvic region, into the bowl below, okay, below the brim, that's the true pelvis. What would be in the true pelvis? Your bladder is down there. Some of the large intestine is down there. The uterus is down there. The ovaries are down there. Okay. That's the true pelvis. However, let's fill that pelvic region with water and bring it right up to the lake shore, right here. Everything above it to the top of the iliac crest, this is false pelvis. When a boxer is said to get hit below the belt's really up here. If you get hit below the belt, you're getting hit in the false pelvis. The true pelvis is deeper. Okay?
Thank you.
The hole right down here. What's that one called? Look it up if you need to.
Obturator foramen.
That should be it. Obturator. Oh, that's wrong. It's spelled with a B. May actually be spelled with a U. Can you see it on your sheet?
Yeah, it's with a U.
Okay. It just didn't look right to me. Now I wonder, do you think it would get marked wrong? I think I'm going to leave it wrong just to see. In my class, when it's face to face, I don't like to grade spelling. There's so many different spellings. When you get out in the real world, most people spell things differently, and certainly they pronounce them differently, like you've just shown me. So I only mark off on spelling when the spelling is so bad, so atrocious, that it would make you look like a fool to your colleagues, to your supervisor, to anybody who does an evaluation on you, so that you shape up here, not there when you're on the job. Okay. But there's no spelling involved in this class. I can't stand leaving that E there, but I'm going to do it. Okay, here was that joint between the ilium and the sacrum. Or take it the other way, sacrum, ilium, sacroiliac. When the question says name the joint, you don't have to, oh God. When the question already tells you it's a joint, you don't have to write the word joint. Okay. If it says name the bone, it's pointing to the parietal bone, you can just say parietal. Okay. What's this great big indentation on the posterior side?
Greater sciatic notch.
Yes. If you put just sciatic notch, you would get marked wrong, but not for us because you're only going to get the correct answer. I'm not going to put sciatic notch as first choice, greater sciatic notch as second choice, lesser sciatic notch as third choice. That's purposely trying to fool you. I'm not going to do that. Here's 22. Is this a right or a left bone? You'll get asked a couple of these. First off, is this the front or the back?
The front.
It's the front, the anterior side. Look down here. Here's the patellar surface. It doesn't have the big notch, the intercondylar fossa showing. That's on the other side. Okay, so if this is front, in anatomical view, the head must attach to the body, which must be over here. And so is the bone right or left?
Left.
Right.
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 Okay. Michael, you missed it again. Was that you?
Me?
Yeah.
No, I said right.
No, that was
Oh,
me. I
oh,
said left.
okay. Well, you will never miss it again. Okay. What do we got here? This is the posterior side. Here's the intercondylar fossa, head, neck, and here's the greater trochanter, and this is the lesser trochanter. If you just sort of put trochanter, forget it. This number 24, now it wants the notch. I told you what it was twice. It's on the distal end, posterior side of the femur. Name the notch.
Intercondylar fossa.
That's it. Okay. I think this test spends a little too much time on certain bones. Here's the patellar surface. I already told you that. Name the bone. What's the bone?
Fibula.
Sure. And now we're back to multiple choice. I like this. And with only 3 answers. No, only 2 answers. What's this point here? Now remember, the fibula is always lateral. So this is the outside of the ankle. This is the lateral malleolus. At the top of the tibia, remember the 2 peaks that make up Saddleback? Santiago Peak and Majeska Peak. What's the name of that structure? And it's okay to look in your notes.
Intercondylar eminence.
That's it. Uh, now, it wants to know this large bony portion of the tibia. Okay. This articulates with another large bony portion of the femur above it. First job is to determine if it's lateral or medial. If the fibula is lateral, this is medial. And this is a medial condyle. In identifying the bone, you need to be specific. Actually, another way of saying it is, in identifying the bone, the 5 possible answers need to have the specific correct answer. So what is the name of that bone?
Metacarpal
Metacarpal what?
4.
4.
4. Usually we write it with Roman numerals. Okay, so we bounced up to the hand now. We've left now, it wants to know this one carpal in the hand. Maybe I should enlarge that one a little bit. Here's the thumb side. Oh, gee, we learned the thumb on the other side, so we've got the other hand now. I don't like the fact that the metacarpal 1 on the thumb. We know it articulates with the trapezium and metacarpal 2 with the trapezoid, but I don't see it in this mess. That looks like the trapezoid. Sorry, that looks like trapezoid. The trapezium probably over here, but not very distinct. But fortunately, the question is not asking that. I always head for the middle finger. Go on back and find the capitulum, and right under it, the lunate. Okay. You can also go from the scaphoid over to the lunate. And then you have the triangular. And the pisiform does not show. It's on the other side, roughly here. So the answer for this one is lunate. On the foot, okay, so we are jumping around in this test anyway. On the foot, little toe, 5th digit, metatarsal 5. Way too easy to mix up the words tarsal and carpal. Be careful. Also on the lateral side of the foot, we have this bone that articulates with metatarsals 4 and 5.
The
And
cuboid?
yes, it's the cuboid.
I broke that bone. I will never forget it.
How'd you break it?
Dancing on point shoes.
Oh, okay. I hate dancing. Sorry. It's not bad to look at sometimes. But in my PE class in junior high school, come on, couldn't they think of anything else to do but have the boys and girls come together on the asphalt outside, play a recording, and make you dance? I don't understand what the purpose of that was. You know, these days, boys and girls, if they want to dance, they dance. They don't have to have any coaxing. I hated it. I hated it. They made us choose a partner. I was very shy. I didn't want to go up and ask a girl to dance. Uh, so I waited around, and then I watched and found some poor girl that never got asked, and I asked her. And when she and I agreed that we'll always ask each other, so we don't have to go through this nonsense anymore.
You were traumatized. I can't blame you.
I was what?
You sound like you were traumatized from it, so I don't blame you for not liking to dance.
Yeah, there are other things that are more traumatizing than that. I mean, if that were all, I had a pretty good life. Let's see. Okay, cuboid. Let's go up to this one. What's the functional classification of this joint? Use the correct term. The joint is the shoulder. Okay, that's a common name for it. What is the functional? That's the key word. This one takes a little thought. What's the functional classification of this joint? This would be a perfect question actually for a lecture test.
Diarthrosis.
Would that be synovial? No.
No?
Diarthrotic.
Okay. Somebody else already said that one, and that's correct. It's diarthrotic because you're looking at functional classification. Synarthrotic, amphiarthrotic, diarthrotic, fully movable. So that's a diarthrotic.
Will that be on the practicum?
I don't think I'd put it on. Okay. As I said, this is not my practicum. But how many instructors can change the bones and make a different test? You can't. So I'm using this test because I don't want to give away all my questions. I'll give you some. Okay. This is a sampling from an actual specimen. Identify the structure. Okay. Now you remember we have lateral and medial collateral ligaments. What side is this? Lateral or medial?
Lateral?
Yes,
Lateral.
because it's the fibula. This is the lateral collateral ligament. It can also be called the fibular collateral ligament because it attaches to the fibula. I prefer to use lateral collateral. Okay, on this side, this is that cushion between the condyles above and below it. This is on the lateral and medial side.
Medial?
And what's the name of the cushion?
Meniscus.
Yeah, so it's the medial meniscus. Okay, identify the bone. Well, that's all we have to do. We just only have to name the bone. Okay, it's on the thumb side. What must it be?
Ulna?
Nope, it's the radius.
Radius.
People get confused. They think the ulna is bigger. It is at the other end, at the proximal end. But this is on
It's
the
okay. I
thumb
thought it
side.
was the ulna too.
And that end, that's the head of the radius, right?
This, no. Head of the radius is at the other end. Head, neck, radial tuberosity. Okay, this is the head of the ulna. I didn't tell you that, and you can go ahead and forget it. Okay, but you can't forget on the radius, head, neck, tubercle. It'll probably show in a moment. Okay, this large bump on the femur, we've talked about it already. Here's the head, neck, and this is the greater trochanter. here's a joint, and this one is slightly movable and cartilaginous. It joins the two pubic bones. What was it called?
Pubic symphysis.
Pubic symphysis.
Or it's called also the symphysis pubis. Does this skeletal structure belong to a male or a female? Forget all the other stuff. Look at the angle here. Okay. If it's wider than 90 degrees, it's female. Is it wider than 90 degrees?
No.
It's male. Looking at the shoulder again in an x-ray again. Okay. Let's see if the x-ray gives you any trouble. This is the head of the humerus. Here's the glenoid cavity. This is the clavicle coming around.
Is it the acromion?
That's right. Here's the coracoid process. That takes some thinking. But this is the acromion, okay, of the scapula. I'll be interested to see if I get marked off for this one because I put the word "the" in it. We're getting close to the end of this test. This is the patella, and the pointed portion of the patella is the what?
Apex.
Apex. Below the patella, attaching it to the tibial tube.
Charlie,
Yes.
can I ask, how did you know that that was the patella? Like, how do you tell from that view?
Okay, what else does it look like? One rounded sort of bone. What else could it possibly be? Okay, that's how I tell anyway. Okay. Take a look at it a couple of times before you come to the test. It's on there. Okay.
Charlie,
Yes.
you have to put apex of the patella up on the top question because it has.
Oh God. Yeah, I'm gonna miss it. Nothing we have to worry about. Okay. Now I want the ligament that attaches bone to bone. It attaches the tibial tuberosity to the patella. What's that?
Patellar ligament.
Yes, it is. Question 44. We're on the femur. That's obvious. We're seeing the front side. Here's the back side. And here's this ridge on the back. What's that guy? The one that attaches to the hamstring muscle.
Is that the linea aspera?
Yes, it is. Linea aspera. 45. Identify the structure. You know, I would not ask you this question. You may misinterpret it. It looks like it's asking about that joint again, the symphysis pubis, but it's really asking about this area here from the pubic bone on one side to the pubic bone on the other side, and it's not on your study guide. So let's get past it. It's the pubic arch. Here's the head, the so-called hole in the head. Of the femur. That's the fovea capitis. $47. Now this is a tough question, but legitimate. And it's not past me to ask you this one. Okay, you're at the lower end, the distal end of the humerus. You see two indentations. One above the capitulum. The radius rotates into that. That's the radial fossa. And one here, the ulna rotates into it. And this is called the coronal fossa or coronoid fossa. Coronoid fossa is the one I think was in the study guide. You know, that's probably the hardest question on the test. Certainly this isn't the hardest question. It's an X-ray. So again, let's expect a couple of X-rays.
The ulna.
This is the ulna, but it does, you're right. It's only wants you to identify the bone. It's really showing to the olecranon process. But the bone is the ulna. What's the general structural classification of this joint? That can only be fibrous, cartilaginous, or synovial.
Is it fibrous?
Synovial. And now the last question of your exam wants to know this structure out here. I pointed it out a moment ago. It's the distal end of the humerus, and that's the medial side here. How do we know? The capitulum articulates with the radius, and the radius is on the lateral side. So this is medial epicondral. Different spelling. Okay, and that's the end of that test. And can you see the little, yeah, I'm able to move the bar. Okay, let's submit it. How many do you think we got right out of 50? Now we should have gotten 50 right, you know, since I was here to check. But we left a couple of things that we think are misspelled. Let's see how this works. Okay. Oh my God, we only got 34 correct. That's not possible.
Now I'm really nervous.
No, I'm going to show you, you don't have to be. Okay, I'm just going down through here. I want to see what was marked wrong. Okay, here we said that this was the axillary border. That's correct. That is correct. It's also known as the lateral border, and if had we said that, it would have marked it right. Okay, so we didn't miss it. Recording. The next one, identify the bone. We put clavicle. That's an acceptable spelling of clavicle. What the hell? We didn't miss it. You see what you're going to do when the test is over? You're going to go through and check everything that was incorrect. You'll either agree, huh?
It was spelled with the CLE, not CAL.
Where'd it go?
Yeah, it's CLAVICLE.
Okay. Okay. I can go with that. But I'm not going to mark you wrong. You're not going to have a chance to make that mistake anyway. Okay. This one, we called it the sulcus. They called it the groove. Okay. It was just nomenclature. This one, how can we miss the styloid process? Because I put of the radius. Okay. And that was the correct answer. And yet this kind of test marks things wrong. You don't worry about this. Now, when you get to another class and they're going to tell you they're going to do a test like this, better study it exactly, letter for letter. It's more of a spelling class. Okay. Semilunar notch. That's also known as the trochlear notch. So it's correct. This one is the radial notch. Oh, there's nothing wrong with that. This is the olecranon process. They just wanted olecranon. Nothing wrong. This one, I misspelled iliac down here. Okay. We knew what we're doing. Obturator, we left the E in there and it should have been the U and we knew it. Okay, so again, we're not hurting. Okay, this one. Oh, medical. I wrote medical condyle. That's what you get when you mistype. Okay, so I'd have missed that, but you wouldn't miss it because it's going to be pick the radial button. What do they mean? It's not metacarpal 4. That's metacarpal 4 if I've ever seen it. What do they want?
Number.
Number. That's a Roman numeral. Isn't that a number? Okay. Just nonsense. I'm sorry. It's not nonsense to show you all this because I wanted you to feel more comfortable with what type of questions you're going to get on the test. Okay. It wanted number 2 also. So it wanted 5 here. I prefer the Roman numerals. Nothing wrong there. Meniscus, I mistyped. Should have been meniscus. Here I put the extra word the in. Oh, didn't like this. I put the word the in. I just wanted apex of patella. Crazy. Incorrect. Why? Oh, because it's not the pubic arch? Certainly is. If you disagree with an answer, and not just to get a higher point, but actually have a factual disagreement, by all means, tell me about it. And the last one, medial epicondyle. I shouldn't have put the E on the end. Okay, so academically, we knew everything. Secretarially, we misspelled a couple things, or I did. Okay, I'm gonna give us a break until 2:30, and then when I come back, uh, I'll show you a few pictures from the actual practicum, the one that you're going to get. Okay, so that you get an idea. Do I use the pasty white ones or what? Okay, and then I'm going to ask you what bones you would like to go over. I know you want the skull, but I'm not going to do that till tomorrow because it needs to be as fresh as possible in your mind. But of the other bones, you can ask me questions. I have the bone box behind me here, and I'll pull them out. But I'll spend about 10 or 15 minutes when we come back going over to the actual examination. Okay, so take a break for till 2:30. Sorry, I kept you longer there. I got to learn to spell. Okay, see you soon. Okay. Okay.
Charlie,
Yes.
I have a question. So is the practicum test on Thursday going to be like the practice quizzes that we've been taking?
No, the practice quizzes that you took were text-based. There were no images, right?
Right.
Those were questions that you could expect to find on the lecture test a week from Thursday.
Got it.
They were not directed to the lab.
Okay. And so what you've been going through and
Today,
preparing us, that's how it's going to be for Thursday?
that's no. Yes and no. Yes, those are the pictures, types, and I'm going to show you some more. But
Got it.
it is only going to be multiple choice. It is
Right.
not going to be us typing in letters to check our spelling or anything like that.
Thank God. Okay.
No,
Thank you.
yeah. I believe in, I told you yesterday, I believe in fairness. I guess I called it justice yesterday.
And getting even?
Yeah, well, or getting ahead, if possible. I've had that, so I don't want any unfair questions. If I were taking the class, I wanted a question that finds out whether I know it and I get credit for it, or I don't know it and I don't get credit for it. Okay, and that's the way it is. There's really no going back on these practicums. We don't have a cumulative practicum, so you want to get it right the first time. So we sort of go over it and go over it as much as we can. If the student keeps up and does their homework, if I call it that, studying, everything works out. On the other hand, if they don't, then they lose out. Okay, and that I would have to consider fair. Fair is fair. Unfair is unacceptable. So if you get a question mark wrong and it shouldn't have been, I'll fix it. I'll fix it. You know, for you. Okay.
Charlie?
Yeah.
So you said we don't have a cumulative practicum?
No.
So we're not going to go over in a later date any of the bones, like.
You're going to use the bones in learning the muscles.
Got it.
That's why they come first. You need the points of attachment and stuff like that, and you would only understand it if you knew the bones first. So it all builds on itself. It's not though meant to be learned once and forgotten. We all do that. We all get to where we are on the basis of what we once knew, and now we have forgotten. I mean, in 11th grade, you probably took a civics class, a history class. How much do you think you remember of that? How useful was that? How much of a waste of time was that? But you got on your record, it says you took history 127 or something like that. And it was only an advancement to the next class. You get to where you are on the basis of what you once knew. Now, there's a certain amount of information and stuff that you keep with you forever. And especially if it's around your job or your hobby or your family, something like that, you keep it forever. But a lot of that we took time learning in school, unfortunately, it was dead time. Uh, yeah, I'm a teacher, and I'm saying that. Okay, so what? I want fair. I want fair. I've wanted fairness ever since I was a little kid. I'll tell you one story just to relax for a second here, and then we'll get busy. But when I was about probably 5 years old, we lived in my sister and I. She was 4. We lived in Los Angeles, right in the downtown, almost downtown Los Angeles, but it was junky. We had an alley in our back. You could see everybody's backyard. It was just tall, dry grass. Nobody bothered to water their backyard. Their front yard they may have kept, but the backyard, no, it was nothing. And we'd walk down the alley, and we'd see 4 bums, we call them bums, sleeping in the grass, actually sleeping it off in the grass. And we'd throw rocks at them because we knew they couldn't chase us. That wasn't very nice, I grant you. But we went down to Kathy's house, down the end of the alley. Kathy was our age, and we got there in her backyard. I mean, the dry grass was as tall as we were as little kids. And there was an incinerator there. We all burned our own trash. Everybody's house had an incinerator. Okay. And it wasn't running at the time, of course. We got there with Kathy and we just thought, well, what do we do now? Well, we're kids. We make up a game. We make up a game. Well, Kathy came up with the game. Okay. Her game, which sounds so lame, now, of course, but at the time it was fine. Her house, a big house, 2-story thing. In the backyard, there was a garage, and it had a shed up against it. Most garages were detached in those days. I'm talking the 50s here. And she said, you can lock me in the shed, put me in there in the dark, count to 30, and let me out. And then I'll put you in there, you and your sister, for 30 seconds and let you out. Well, what a stupid game. Where's the prize? But we did it. We did exactly that. We put her in the cabinet, thinking it would freak her out, but it didn't. And she comes out. And then my sister and I step into the cabinet, and it's closed. At the end of 30 seconds, we're shouting at her to let us out. Let us out. And she wasn't even there. And she had padlocked the shed. She padlocked us in there and took off. And we were kicking and everything we could, but now we're getting frightened. And kicked the door of the shed down finally. Couldn't believe we got out of there. But I look up to the second story of her house, and there she is in her bedroom window, just laughing her head off. It was funny to her. It wasn't funny to me. We were scared to death. My sister was really freaked. I knew revenge or justice was necessary here. We left. We went home. A little bit later in the day, however, I came up to the back of their house and I brought with me some matches and a little bit of a can of oil. And I went into her yard and I found a stick and I put the oil on the stick, threw the matches in the incinerator, got the thing blaring hot, put the stick in, pulled it out, and I had a torch. And I torched the backyard. I went around from spot to spot and put this torch to the grass and lit the whole backyard up. And I left. Of course I left. The fire trucks came. I'm sitting on my front porch. My mother's coming out saying, go see what that is. Charles, go see what the fire trucks are. I said, no, I don't care. And she said, what do you mean you don't care? You always care. Go see what it is. I said, no, I don't care. She couldn't believe it. Well, of course, I knew what was going on. And I did care enough to sneak a peek and go up the alley. And neighbors with hoses were out. The fire trucks were out and everything. The garage was destroyed. That was the end of it. And I felt I had some justice then at that point. I didn't realize my sister felt the same way. 2 days later, or 2 or 3, we were told to go to Kathy's house, that she was very, very sick. And the doctor had been there, they made house calls. And we went up to see Kathy, and my sister was acting a little strange. You know, I had just burned down their garage and they didn't know it was me. And although Kathy may have had some suspicions, but my sister and her didn't get along anyway. And we left. Kathy recovered. They were afraid she wouldn't. It turns out, I didn't know it at the time. I didn't know it until maybe 40 years later or so, when I met my sister, who was living now in Idaho, so you can figure out what kind of crazy she was. She came to Las Vegas and we met, and we were at the Rainforest Cafe, and she told me for the first time what she had done as a 4-year-old. She took a stick of oleander, which grew all over our place, and she rubbed it inside of the hose, scratching the plant inside of the hose that everybody knew Kathy would drink out of. She always drank out of the hose. Olisine, which is in Nerium oleander, is a deadly, deadly poison. And fortunately, she didn't get enough of it, but she drank out of the hose, and my sister poisoned her. Uh, I had a new respect for my sister. Okay. Now, getting back to our stuff. Do you have any questions before we leave? And okay, I'll go. Oh, let's get rid of this. Let's get rid of that. No, week 2. Okay, it doesn't have the lab test there. So I'm gonna have to bring it up. Okay. The reason the lab practicum wasn't right in front of me is that I took it down because there's always the chance that I'll accidentally activate it, and then you'll have it all days ahead of time. So I didn't want to do that. I'll deactivate that other. I might as well leave it now. Okay, here's some practicum. Now this test says it has 105 questions. It won't have 105. It'll have just 100. Okay, this was designed for 5 points of extra credit. But as I said, you don't get extra credit on the practicum itself. You get it by being here with the Zoom, okay, meetings. So you'll have plenty of opportunity to make actually 107 points on the test. But an A is still 90, a B is still 80, etc. Okay, there'll be 80 minutes on the test. Okay, and you'll get your results right away. You need a good internet connection because all 100 pictures are going to come up at once. Okay, Michael, here's for you a picture of an all white bleached model. Okay, here's the skull. and a potential first question. Find the arrow pointing right to that little guy there. Not ideally the first question. There's plenty of others, but it's got to be asked sometime. Here's another one over here. Identify the bone marking. Marking is another name for structure or feature. What is that guy there? Now, here are your choices. There are 5 choices. Is it the foramen ovale, the foramen rotundum,
No.
the foramen magnum, or the mental foramen, or the mandibular foramen?
Definitely.
Mandibular foramen.
Raymond.
Okay. There was a lot of overlapping there, and I'm going to tell you right now.
Mental foramen.
Mental foramen.
Now it's changing, isn't it?
Well, I knew it wasn't mandibular because mandibular is, I've just always associated that with like the sides of the jaw.
Well, this is the mandible, okay? And it makes sense whoever named it could have named it mandibular foramen. But instead, they named the mandibular foramen back here on the inside of the jaw. The one out here is the mental foramen. Okay? That wasn't meant to be a hard question at all. So take a look at that portion.
Well,
of course, go ahead.
I definitely knew that it wasn't the top 3, and the mandibular foramen didn't sound right.
So you did it that way. Okay. Now, what's this up here? Now, this could be a hole, but in this case, it's not. It's a little chunk taken out on either side. Okay. Is that the foramen spinosum, foramen rotundum, the supraorbital notch?
Yes.
Yeah, it's the supraorbital. That makes sense. And in this case, it's a notch because it's not a hole. There it is. Okay. The supraorbital fissure is this guy in here. Now you notice that I'm showing you some skull here, whereas the last test did not have any skulls in it at all. Okay, they'll be roughly 1/4 of the exam. Okay, it wants to know this structure here. And now look precisely at where the needle touches. That's precisely what's being asked, and nothing else. Just precisely here. It is not pointing up here. And if you know, as I've tried to teach you, that the upper portion belongs to the ethmoid bone, it's the perpendicular plate. What's this lower portion?
Vomer.
Bomber.
Okay, and you're right. Now we want to know, identify the suture. And it wants this suture here.
Squamous.
Squamous.
Okay, looking at the possible answers, there you go. What's this suture here?
Coronal.
Did you guys say frontal?
Coronal.
Coronal, that's it. Frontal wasn't there, so it couldn't be that one. What's this sharp, tooth-like extension?
Xyloid process. This one wants you just to name the bone. It's upside down. Huh?
Occipital bone?
Occipital bone would be correct. Now, you didn't seem to have any trouble with that one, but a moment ago, somebody was having trouble with the patella. And how do you recognize it? It's sort of like the same way you recognize your friends or the people you know by their characteristics, by their hair color, by their smile or lack of it. It's just, what do they look like? It's memorization.
I recognize it by the foramen magnum.
Yeah, of course. That's a good one. The foramen magnum. 8. I want this structure here, which is the same as this structure here. Take a look at your choices, eliminate all that you can.
Occipital condyle?
I got one vote for this. I'll change it if you got something else.
I'll second that one.
Second, okay. These are the occipital condyles. It's actually not condyle. Sure looks like it. It's condyle, like something is not shiny. It's dull. Condyle. The 9th question. Well, this is for Michael. What is it?
Foramen magnum.
Yeah. When you get an easy question like this, there's no excuse for missing it. There's no excuse for missing it. Now, this one make me think a little bit, but not for long when I compare it to the other possible answers. I want this projection here, which is the same as this one here. I don't want the ones in the back.
Coronoid process.
Coronoid process. There you go. Okay. Here's that mental foramen again. Probably a nicer picture to use for mental foramen. Here, this is the mandibular foramen. This part of the bone or region of the bone, look at your answers.
Ramus.
Ramus.
It's the ramus. The body runs forward and around like a horseshoe. What bone is this?
Temporal.
Squamous.
It wants the bone. Squamous is not a bone.
Temporal.
Temporal.
Do you all study together? Temporal? Temporal. Temporal is how you say it. Okay. Here's the temporal bone. You look at this, you got to realize that that's the external auditory meatus. And here is the first part of the zygomatic arch. The lower portion here is the petrous portion, and the upper portion is the squamous portion. I'm not going to go through all the questions here with you. I think I'd be giving you too much of an advantage, but I'm going to let you look at it, not giving you enough time to read. Tomorrow, when I do the skull with you, we'll have plenty of time. A lot of phenoid bone questions. It just has lots of structures, but I'll go over those again tomorrow. Here's the rib, head, neck, tubercle, groove, body or shaft. Here's the ethmoid bone, taken out of context, taken out of the skull. This is the cristagalli up here. Here's the perpendicular plate down here. Oh, a diagram. I actually do have a diagram. The holes are the olfactory foramina. We're looking down from the top. Here's the cristagalli right here. These are sinuses, if you're wondering. There's the external auditory meatus. Last one. This is the palatine process of the maxilla. You can find it right there. Carotid. Carotid canal
Where would the internal auditory meatus be located?
The what?
The internal auditory meatus. Isn't it in that same picture?
No, it's not in this picture. You got to turn it over. And it's probably coming up. Here it is. Here's the internal auditory meatus here. I'm sorry, here and here. This is the jugular foramen here and here. The alveolar process, the optic canal, the lacrimal bone, the superior orbital fissure. This is the first and second cervical vertebra, one on top of each other. It wants to know the bone. No, it's just the second one, because here's the dens, and so that's got to be the axis. Here it is. Here are the foramina in the transverse process that we find in cervical vertebra. The coccyx, the posterior sacral foramina. Up at the top is the sacral canal coming out down here at the hiatus. Sacral promontory. This one gets swapped out all the time. Which region of the spine would you find this bone? Okay. This is a thoracic vertebra because the spinous process slopes down. Cannot be a cervical vertebra because it doesn't have the foramina here or here. It's not the sacrum. It's not the coccyx. The only other thing it could be is lumbar, but then it needs huge spinous process. That's pointing to the lamina. It's in color. Superior articular processes. The arch or vertebral arch. The groove again. This is the sternal end of a rib. It's the end that touches the sternum. This is osseous tissue from compact bone. The manubrium. The costal notches. The hyoid bone. You may not have seen that before, but there you go. This is a real good close-up of one of the ear bones. It's the malleus. The malleus. It's supposed to look like a hammer. I never quite understand that, but take their word for it. The incus looks like a tooth. This does not. And the stapes looks like stirrups, and this does not. So just by elimination. This is a floating rib. Oh, you saw this picture earlier. So I do have some that were taken. We saw this. Okay. You have seen all the rest of them that were on this test. What was added is the skull. Okay. this is true of all tests that are multiple choice. If something gives you trouble, flag the question and come back later. Don't waste your time on a question. There's going to be probably a couple you have to guess at anyway, and make the ones that are giving you the most trouble. Okay. How much work do you personally think you have to do between now and the practicum?
6 hours worth.
Okay. Julie?
Just review.
Just review. Yeah. Okay.
For me, there are some bones that I need to look at from different angles. Like I'm able to identify them from one side, but I need to look at all of the different angles because the practicum seems to have angles that I wasn't familiar with.
Okay. For instance.
There was a view of the sphenoid that was a little bit confusing for me.
Okay, I'm looking for others. I'm not looking for bones of the skull today because I want to do those tomorrow. Bones of the skull give people the greatest amount of anxiety, I guess. They don't need to, but the closer they are to the test, the better the chances are that you'll get them correct. So I'll do the sphenoid with you and have it in my hand, okay? For you, but I want to do the skull tomorrow. Any other bone I'm willing to do right now. How many A's we got coming? You can do it with showing the hand, you know, reactions.
Charlie, would you say the skull would be the hardest part to like memorize, or is it like the other parts of that we're studying for right now?
I don't find well, you're probably asking the wrong person. I don't find any difference in memorizing skull or anything else. For instance, foramen ovale, how hard is that compared to intercondylar fossa? To me, they're all the same.
Of course.
But like I said, I'm willing to hold up any bone that you can name other than the skull. The skull I'm going to do tomorrow. Okay. And turn it around in all aspects and go over it with you. The skull is really kind of hard to do also. Trying to hold it in front of me like this and get the right orientation and get just so you can see the little holes. It's very frustrating, very frustrating. Like I said, we need another person with the handheld camera to zoom in on it. The other bones are easier to do in that respect, but just as important as far as the number of questions that you want to get right.
Can you show us the radius and the ulna?
Yeah. I don't know how close I have to get to you guys. Okay, I'm just, let's see. Okay, I've just got the camera on me. Okay, is that what you see?
Yes.
Okay, I have to have it just on me so I can see what I'm doing here. Okay, here's the ulna, top part, and it does look sort of like a wrench or a bar. It looks like a snake's mouth. It looks like a carnivorous plant. At the very top is the olecranon fossa. Sorry, the olecranon process, or this the olecranon. Drop my finger into the mouth, that's the trochlear notch, and come out to the very, very tip, right out here, right there. That's the coracoid process. Okay, that's just about all up here, except for one thing. I'm going to put my thumb on the coracoid process. I'm going to slip it to one side or the other, and it's on this side. Come on. That I've got my thumb in right now. If I take it away, you'll see a nice smooth indentation. That's the radial notch. The radial notch. The shaft, and at the very bottom, the styloid process of the ulna. Styloid process of the ulna, right there. Sorry, if I get too close, it goes out of focus. If I take the radius, the head, neck, and tubercle. No, I said it wrong myself. But at least on a test, you have time to think. It's head, neck, radial tuberosity, or tuberosity. Go back down to the other end, and the point that would touch the ground first, right here, is the styloid process of the radius. On the other side,
Can you point
here,
out the process again? Sorry.
pardon me?
Can you point out the styloid process again? I couldn't see it in screen.
Yeah. Well, something happened to the lower part of the screen here. Here we go. It's this structure right there, the lowermost structure.
Okay. Thank you.
Okay. I've lost the picture of myself. I don't know what's going on. Oh, I got to keep speaking or it shuts off. It's usually not a problem for me to keep speaking, but okay. If we find that, I hate this. That's why I don't like to use the bones. I'm in my own way all the time. Okay, here's the styloid process. Go to the other side, and you'll find here the ulnar notch.
Which one is more lateral?
That's a good. No, the most lateral is the radial, styloid process. Styloid process of the radius is most lateral. The two bones come together, and the joint is medial. I want to come back up into the top here and show you the radial notch again. And it fits right into here. The radius the head fits into the notch. Okay. That's it. It's not a complicated bone. It's just frustrating as hell to try to hold up everything yourself. And you got to try it sometime. Everything is backwards, first off, and you don't have anybody taking the picture. Okay, but I'm willing to still try it again with another bone if you'd like.
Charlie, can I please see the humerus?
Humerus?
Yes, specifically the distal end.
Easier if I put it upside down. This is the distal end of
Oh,
the
and
humerus.
Charlie,
Yeah.
someone said in the chat that if you press the 3 dots in your top right video screen and then pin the video, you'll remain on the large screen for yourself, so you don't have to keep talking and it won't.
Okay, I'm
leave.
in the view. No, I don't have
And then
to
you
be.
pin your own video.
Where did, oops. Where did they say to go, please?
They said go to the 3 dots in the top right of your video screen.
I don't have them. I
If
know
you
what they look like.
If you
I
put your mouse over your own video, and then
Oh,
you'll get
okay,
your
gotcha.
three dots.
Then
And then you press pin.
pin. All right. Somebody's, well, anybody's better at this than I am. I mean, I just got it down well enough to get through it and show all the material. I don't like online any more than most people do. But thank you for doing that. Okay, so here's the distal end, and this rounded object, which is on the wrong side for me, right here. That's the capitulum. That's the capitulum. I don't have enough hands. It ticks me off. I can't hold it up for long either. Here's the head of the. You just want to see me struggle. Okay. The head of the radius is here, touches the capitulum. Okay. Hang on for a second. I have a tool that, if I can find it.
I think you knocked your thing. We can't hear you, or I can't hear you.
Sorry,
Is he on mute?
Charlie, we can't hear you.
I think you said to do the reaction button.
Yeah.
Which one?
He pinned his video, guys, so he can only see himself.
Oh.
Oh
no.
Okay, I'm back.
There we go.
Oh, okay.
Good. Oh, good.
It worked. You raised a hand, and I said something, and you don't respond. So I know I'm not. I've kicked out the contact. Okay, I'm going to hold it against my head to hold it still. This is the trochlea here. Okay, this one over here is the capitulum. Above the capitulum is the radial fossa. And now you can see it above the trochlea. There's another indentation. That's the coronoid fossa. There's the coronoid fossa above the trochlea. Okay, that was the distal end. The only other thing is on the posterior, the large cavity that you find here. Okay, this is the olecranon or olecranon fossa. Okay. Up at the other end, the proximal end, a nice smooth cap, of course, is the head. There is a projection on the medial side. This is the, I'm sorry, on the lateral side. This
Can
is
you
the
lift it up
medial
just a
side.
little bit? Thank
This
you.
is the medial side. There's nothing to balance on here. This is the medial side. This is the lateral side. And this is the greater tubercle. In the front, right here, is the lesser tubercle. Okay, so lesser tubercle here, greater tubercle over here. And then the space in between, right here, is the intertrabecular sulcus. Okay. Surgical neck is right here. And surrounding the skull cap is the anatomical neck. Halfway down, I'm able to feel it, but I don't know if you'll ever be able to see it. Halfway down the posterior side that I'm showing you is the deltoid tuberosity right here. Okay, what else do you want to torture me with?
I'd like to see the tibia and fibula, please.
Okay, here's the anatomical view of the upper half of the tibia. We have to know which is the medial and which is the lateral edge. And for that, we have to go to the distal end. The medial malleolus over here. Sorry. Here it is. The medial malleolus is on the medial side. Okay. On the opposite side of it, right here, is the fibular notch. A little shadow on it. Let's go back. Medial side, remember which side is on here now. So this is the medial side over here. This is the medial condyle. This is the lateral condyle. In between is the intercondylar eminence. And drop down in front. This is the radial tuberosity.
I'm sorry, wouldn't that be the tibial tuberosity?
Tibial tuberosity, you're right.
Okay.
I was thinking ahead to something else. Okay. Yeah, that's the tibial tuberosity. Okay. Now, the fibula is tricky, and I don't like to ask it separate. I like to ask it when it's put together, and would fit roughly like this. This would be just underneath. Okay, that's the fibula on the radial side. And then I come down to the other end, and it's sticking out a little too far because these bones weren't coordinated enough. Okay, and that's the lateral malleolus. Lateral malleolus. When you look at this bone, it almost looks like both ends are the exact same. I'm going to back up a little bit. Okay, there we go. Does one end look more chubby or irregular and the other end look more snake-like?
Yes.
Is this the end that's chubby?
Yes.
This the end that is more snake-like. The
Yeah.
snake-like portion goes down and makes the lateral malleolus. The other portion that sticks up underneath the condyle is the head of the fibula. Okay. Now, if I were to show you this in conjunction with the tibia, in other words, the two articulated are put together, I would expect you to definitely could get the head of the fibula versus the lateral malleolus. Okay. You just did it without putting the two together. I know you can do it when they are put together. Okay. I put that darn phone on silent mode. It just won't shut up. Sorry about that. That's me. Okay, what else?
Is it too difficult to do the pelvis or the pelvic bone?
Okay, you have to realize it's going to be in two parts, right? Okay.
Okay.
I don't care if it's difficult. I mean, I get paid for it. It's just awkward. The setup. I've tried to organize things so that I could have something to set up on, but I haven't done a good job. What the hell is that? Okay. Let me raise this chair a bit. Maybe that will help. No, that's as high as it goes. Okay. I'm going to do it standing up. Maybe that's what it took. You know, the big hole is the obturator foramen. And where the hip goes is the acetabulum. Looking at it in profile like this, the part that I'm holding is more pointed than the blunt posterior portion. Okay. I'm going to hold this in a certain way through here and across the top. That'll keep it always in the correct orientation. Turning it towards you, this is the iliac crest. This is the iliac fossa. Put my finger at the top, and I'm going to go laterally. How do I know I'm going laterally? Look where my hand is. I put it in from the side. I put it in from the side, And there's the acetabulum where the hip goes. So it's got to be lateral. Going to come across the top of the iliac crest to this point. This is the superior anterior, or you can say it the other way, anterior superior iliac spine. Drop down, and this is the anterior inferior iliac spine. These two spines here, combined with the two on the other pelvic region, make for the two bumps on your sides, at your hips, when you're in a bathing suit. Put my finger back on top. I'm on the iliac crest. I come across until I get to here. This is the posterior superior iliac crest. Drop down, and it's the posterior inferior iliac crest. That's these two. Underneath the posterior inferior iliac crest, we have this large indentation. And that's the greater sciatic notch. Greater sciatic notch here comes down and ends at the ischial spine. Here's the ischial spine again. Right below it, just barely enough to put my finger into, is the lesser sciatic notch. The greater sciatic notch, ischial spine, lesser sciatic notch. Then behind it, this is the tibial tuberosity.
Ischial tuberosity, right?
Tibial tuberosity. Oh, I said it again, didn't I? I'm reversing these around. This is the ischial tuberosity, the part you sit on. Okay. Where is the pubic bone? I'm completely covering it up with my hand. It's up here and it's here. So now I'm freeing up the pubic bone. And this portion here makes up the suture we know as the pubic symphysis. It's right here. Across the top and matching the paired bone, the other one, is the pubic arch. And that's nowhere to be found on the test.
Charlie?
Yeah.
The ischial tuberosity and the ischium, how do we distinguish between the two?
No, just know the structure, okay? Because the bone is so perfectly fused that you can't tell the difference between where ilium starts, ischium starts, pubic bone starts. You can only tell general areas. You can also look at the book where they have it, with dotted lines for yourself, okay? But down here, I'm holding it by the pubic bone. Up here, I know I'm holding it by the ilium, but I don't know where the ilium stops. Not quite. And the ischial tuberosity back here has got to be a part of the ischium. Now, one thing I do know, get back a little bit farther, is the acetabulum, okay, is the meeting point of all three of those bones, the ilium, the ischium, and the pubis bone. They meet and form the letter T inside, straight across the middle and then down from the center the other 2/4. Take a look at the book and you'll see that illustrated. Okay. In order to do the pelvic brim or anything like that, I would need to have an articulated skeleton. That I don't have, but the pictures in the book or in the practice quiz should do fine for you.
Charlie, this might be a little bit premature, but what goes inside the obiturator foramen? And I'm probably mispronouncing that. My apologies.
No, it's okay. I said it the other day. The obturator nerve, the obturator muscle, and there's a vessel that's for a short distance called the obturator. Okay.
Thank you.
There's a lot of stuff that actually goes through there. Otherwise, why would we have that? You know, I've said
It's
also, yeah, we don't necessarily have to have a function for every structure, but this one does have both structure and function.
Charlie?
Yep.
On the practice test, I had some confusion about those bones underneath the metacarpals, just the few here. Can you go over those, that little stacking?
You're talking about the hand?
Yes, sorry, yes, in the hand. But
Okay, that might be challenging for this. Let me find it. That's probably going to be challenging for us here because the bones are so darn small.
the carpal bones, that's what I was getting at.
I know what you're talking about. Let me turn this down. Okay, on this side of, you can see that my right hand is holding the thumb. I'll get back farther. It's the shortest one. I know you know these metacarpal 1, 2, 3, 4, and 5. Okay. But if you go to metacarpal 1 and come down to the very first bone that articulates with, and this is not drawn tightly together. I'm going to force it to be tighter. This that doesn't help. Metatarsal carpal 1 articulates with the very first bone, and this is the trapezium. Metacarpal 2 comes down and articulates with one bone, and that's the trapezoid. There. That's a little bit better for a moment, okay? Trapezium, trapezoid. Go to metacarpal 3 and come down to this big bone. That's the capitate. So I think that's pretty good for these three: trapezium, trapezoid, capitate. And then you have one large bone here that articulates with both metacarpals 4 and 5. And that bone here is the hamate. When you look at the other side of the hamate, it has a projection that comes up. The only one of the bones that does that. Come back to the forward side. I'm sort of just pushing them together as best I can for you. Okay. Go back to the trapezium. The next bone under it, and going underneath the capitate. This is the scaphoid. The next bone is the lunate. They call it that because it looks like a moon. Can you see the moon?
Yes.
Okay. That's the lunate. The next bone, just this one here. Trying to get it so it's also in focus best possible. The next bone is the triangular. Does it look somewhat triangular to you? There it is. Triangular. Also known as triquetrum or triquetral. And then one last bone, this round one sticking off, is the pisiform. You have to learn them in order. You need an order. You need to really start up, as I think it helps most students, start with the metacarpals and what do they each articulate with. That gets rid of the first 4 of the 8. And then go back to the trapezium side, go under to the scaphoid, to the lunate, to the triangular, and to the pisiform.
Charlie, in the posterior view of the carpals, can you not see the pisiform?
You can, if you're going to see it at all, you're going to be shown an x-ray probably, and you'll see it from both sides because you can see through on an x-ray. However, this is the posterior view right here that I showed you. This is the posterior view, and they do have the pisiform showing. Okay, out here, it's more apt to be shown underneath, as you're saying, on the anterior side, but it won't stay there. Okay, well, here it is here. This, I'm holding it up by it, the pisiform. You'd probably see it better on the anterior side, the same side as you would find for the hamate bone, right next to it. There's that hamate we looked at a moment ago. You can feel it. You can feel it for yourself. It's going to be on the side of your little finger. Okay. You feel your wrist. You can feel bump in there at the upper wrist. You can then, if you pound your hand down, you can feel it as well. It's not going to be a problem on the test, however.
Thank you.
Okay.
Charlie, this bone box descriptions really helped just to kind of picture each bone in the different angle that it may be positioned on the exam. So thank you for that.
Okay. Well, we'll need it tomorrow for the skull. And I will actually probably avoid showing you certain things that are actually better seen in the book. I don't want to confuse anybody, that's for sure. But yes, you do get to see things from different angles. And I will do as much as I can on the skull tomorrow. The skull is the part that worries most people. They go back to it over and over again to study. They'll leave the vertebral column alone usually. They go back to the skull because it's got all those holes and all those words associated with it. And when you come to it and you take the test, you find it's equally difficult or equally easy, depending upon how well you studied.
Charlie,
Yes, Mike.
just wanted to know, I'm covering chapter 6 right now, and I'm just doing the outline. Were there certain things that weren't because you said to do the whole chapter, but are there certain pieces of information that's not necessary, or is it all?
No, it's all.
Okay.
Okay, I'm sorry about that.
No, no, you're good.
Okay. A lot of people are getting it in. It's a good reminder to everybody that's still here, and that's most of you. You need 3 chapters before the practicum, not after the practicum. That ticks me off. After the practicum, no, get it done first. We've had plenty of time. But you want to get in the 3 chapters. It can be 1, 9, and 6, or 1, 9, and 2. Your choice, as I said. If you want to turn in all 4, you can do that too and get a head start for next time. But if you don't turn the chapters in, you forfeit your points for Zoom attendance prior to the practicum. And because I'm using those, I'm giving you those as extra credit. I did not want to do an online class when I first was told I had to do an online class because of the pandemic and everything. Most people have told me they don't want online classes in preference to the other. Some people are changing their mind because they don't like driving to school. And I can understand that too. But I didn't want to do an online class. I could not see myself in front of a camera. I was in front of a camera once many years ago at school, and everything fell apart. It was horrible. And I thought I'd do the same thing again. And maybe I have, maybe I haven't. Doesn't make any difference. I don't like being in front of a camera, but that's what has to take place here. There's some things to get used to. Not having all the supplies that you want, not being able to come and look over your shoulder and tell you, no, that's not it, that's it. Not being able to take the radius and ulna to you and show you personally, you know, there's some things that are easier, some things that are not, that's for sure. But this is just what we have to do for right now.
I actually prefer online.
That's fine. I'm sure that there are going to be instructors now that prefer online, and they'll have the online classes, and the rest of us will not. We'll have the face-to-face. I don't know if we take a poll. If we'd have taken a poll a year or just 6 months ago, I know face-to-face classes would have been preferred, but that could have changed by now. Any other questions or things I could do to help you with the practicum on Thursday? Other than to tell you we are going to review tomorrow. Tomorrow we're going to have a lecture also, but I'll get through that quickly so we have time.
Charlie, do we see you on Thursday, or we're just taking the practicum?
You're just taking the practicum. I'll be there. I'll be logged in. I'll wait for you to email me if there's any problems that you have. I watch as you take the test. I look and see how many questions each person's answered, how fast they're going, have they got enough time? Usually so. I'll look and I really snoop around. Okay, but I'm waiting for problems, especially. And if there are any of those, you'll email me. I will be here. You just don't have to look at me. Okay.
Okay, thank you.
Thank you, Charlie.
Bye-bye, Jennifer.
Thank you, Charlie.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Bye, everyone. Thanks.